And here we go. Welcome everybody to The Big Idea, where we're going to be talking about brain health and neurodegenerative conditions. Specifically, we're going to be referencing a couple of them, Alzheimer's and Parkinson's dementia. And we're going to be talking about some really interesting, cool research that's come out that's shown how the function of your spine actually affects the function of your brain. Now, I am not going to be so bold or stupid to make a claim that if you fix an issue in the spine, it's going to fix or it's going to cure different forms of dementia or all different things of brain health. Absolutely not. When a person's had an issue going on with inflammation in the brain, neurodegeneration, post-concussion syndrome, the truth is there are a lot of moving pieces. But what I want to show you first is going to be some interesting research that's coming out that shows that the spine does in fact address some of these issues and can be one of the pieces to improving quality of life. That's going to be number one. Number two, I'm going to describe a few other things that are involved that are very important if a person is dealing with some kind of cognitive issue. But then lastly, at the very end of this video, I'm going to show a very simple screening test that you can do at home if there is any concern about some kind of a dementia, a Parkinson's process like that. So let's go ahead, jump into that. Actually, before we do that, I will do the obligatory ask if you would please like and subscribe to this channel here if you find anything of interest, and or make sure you share this one with friends or family. So, what is the new research? The effects of chiropractic spinal adjustment on EEG, so electroencephalograph, so brain waves, in adults with Alzheimer's and Parkinson's disease, a pilot randomized crossover trial. In this study, we explored the effects of chiropractic spinal adjustments on resting state EEG recordings and early somatosensory evoked potentials in Alzheimer's and Parkinson's patients. In other words, they set up a bunch of EEG sensors for people who were diagnosed by a medical professional with either an Alzheimer's or a Parkinson's, and they wanted to see if by making changes with sensory information from the spine to the brain, if that made a change in terms of how the brain was able to process information. In a nutshell, and what they were looking for is what's called the amplitude of an N30 peak. Now, we're not going to get into all of the hardcore details about what an N30 peak is. The short of it is that we expect to see normal waves when you're looking at an EEG reading. An N30 is a very characteristic kind of wave that shows up in the brain when it is processing different kinds of information. But if you see abnormalities in that N30 wave, that's a predictive factor that the brain itself is not processing information for some reason or another. Either there's a sensory processing issue or that the brain itself is not able to function that at a higher level. So that's what they were looking at. They were looking at, is it a normal waveform or are there abnormalities? Here's what they found. Chiropractic adjustments significantly reduced the N30 peak in individuals with Alzheimer's by 15%. In other words, there was a 15% improvement in how the brain was actually able to process sensory information at a cortical or a thinking level. Resting state EEG showed an increase in absolute power in all frequency bands after adjustments in individuals with Alzheimer's and Parkinson's. Let me roll down a little bit later in the article. I'll give the link in the video here, so I'm not going to read this all aloud here for you, but a picture is worth 1,000 words. So what we have here are a bunch of schematics where they're showing brain activity in the different populations that they were testing. So the first group, and all of the individuals were diagnosed with some kind of neurodegenerative disease. I'm saying that first and foremost. So this is the control group, where they measured delta, theta, alpha, beta, and gamma wave activity in the brain. They would do then a basically sham procedure where they didn't do an adjustment to anything at all, and they wanted to see that by doing that, were there changes in brainwave activity. And you can see that, yes, even if you do quote unquote nothing at all, that you do see increases in theta and alpha activity, but you don't really see that in other forms of brain waves. They look pretty similar to when there was no intervention whatsoever. In other words, no change. But the groups where they did do some type of a chiropractic adjustment, the idea being that it is allowing the spine to move better and as a result send the brain better quality information. You see an increase in normal brain activity across the board. And this last one here, this is showing a difference right through here between the control group who received no actual treatment whatsoever versus the ones who did. And what we're seeing here is we're seeing significant increases in activity up through delta waves, beta waves, and also gamma waves in the prefrontal cortex, which is the part that's involved with logic, thinking, personality, mood. We're also seeing increases in the zones that are responsible for sensation and also motor control in beta, gamma, and also delta wave activity. In other words, you're improving spinal motion. What you're doing is you're actually stimulating the brain. The brain is able to work more the way that it is supposed to. Now, does that mean that that's going to cure Alzheimer's? I repeat, the short answer is absolutely not. But especially when we're dealing with improving a person's quality of life, we want to look at as many different factors as is possible to make sure that a person is able to function at the highest level that they possibly can. And the spine, believe it or not, at least the research is showing this, at least has some impact on that and can help improve quality in life in these people. Similar kind of results were found in the Parkinson's group. So same thing, they had the controlled base level brain activity with those same brain waves. You do some type of non-actual intervention and you see no real increases whatsoever, but then you do see across the board increases in all brain wave activity. In other words, by sending the brain good quality information, not bad quality, we're seeing that the brain then is having to process that and has a substantial difference in terms of being able to function more at the optimum or more at the normal level. So what's the takeaway message thus far? Simply put, it is that the function, the health of your spine does affect the health and function of your brain. And this is for people whether they do have a neurodegenerative disease, whether they don't, whether they've had a whiplash injury, whether they have concussion injury, whether they're having vertigo, balance, brain fog. That one of the critical pieces is to make sure that the spine is working the way that it is supposed to. I repeat, does that mean that it's going to fix, quote unquote, all of the issues? The short answer is absolutely not. But we do want to make sure that all of the bits and pieces are moving as good as they possibly can so that brain and body are able to work at the highest level possible. But as it relates specifically then to Alzheimer's, to Parkinson's, there are a few other factors that I want to address. This goes outside of the chiropractic sphere because these are some of the things that can set people up for a few different kinds of issues here. And I want to let you know what some of those different things are so that if you either A, are concerned that you have a risk factor for this, or B, somebody in your family, a close friend has experienced something like that, that you're able to look at all of the different pieces that are involved. And truth be it, there's going to be way more involved that I'm going to get into in this little video. But here are the few things that I would be looking for right off the bat if this was somebody that I cared for personally. Let's have a look at those. Number one, and I would actually argue that this is probably the most important. It is the health of your digestive system and a normal communication between the brain and between the rest of your body, specifically the vital life organs, your thyroid, your heart, your lungs, your reproductive, and also your digestive system. This conduit is the nerve that you see in the bright yellow right here. It's what's known as the vagus nerve. It comes off of the base of the brain stem, the medulla, comes out the base of the skull, along the front of the neck through here, and ultimately goes down to every single one of your vital life organs. 20% of the information is going down. 80% of the information is coming back up, and the bulk of that information is coming from your digestive system. So if and when a person is eating something, they've either inhaled, ingested something that, simply put, is not good for their body, guess what? Brain is going to become aware of it. But one of the issues that we see a lot of times, if a person is dealing with some kind of a traumatic brain injury, or if they are also dealing with some kind of cognitive impairment, what's going to happen is you are not going to be having the normal transmission of those normal kinds of messages. As a consequence, or especially if there is something in our digestive system that is not good for us, either A, we've been exposed to a bacteria, we have a yeast overgrowth, we have mold exposure, something like that, the normal tight junctions of the digestive system like this, which are very selective to only let the good quality of stuff get into our bloodstream, those tight junctions, they start to get loose like this. And as a result, things start leaking into the bloodstream that should not be there. The result of that is this starts an inflammatory process that's going to be in the blood, and guess what? Brain is one of the major organs in your body that requires blood. And if you've got something in there that's promoting an inflammatory response, that's going to affect not just the local digestive area, that ultimately can go up all the way to the brain. And in fact, there's research that is demonstrating that one of the things that's very, very common for people who go on to experience either Alzheimer's or Parkinson's is a dysfunction of the vagus nerve itself. In other words, it's as if something is traveling up from the vagus and it's ultimately penetrating, it's affecting the brain at that level. So, one of the risk factors for people who are going to experience a neurodegenerative issue is chronic constipation. Now, this does not mean that just because a person may have constipation, or even if it's very chronic, that they're going to go on to experience a neurodegenerative condition. But I do want to say that especially if you're noticing cognitive impairments, if you're noticing difficulties with mobility in different joints of your body, and if you're noticing you also have digestive issues, it's like this could be a bit of a common link, and it's something you should be aware of. What you want to do then, and this is the case, you want to have proper digestive health testing. This is technically or usually done with either a functional medicine practitioner, or this is done with a naturopathic doctor, where you can do all kinds of different tests to find out what is inflammatory in your body. And I've done a lot of different videos about this, that when you are dealing with something that, simply put, is not good for you in your diet, two of the early things that you can look for yourself is that your sinuses, you just always feel congested, or you eat even just a tiny little portion of something and you immediately start to feel bloated. These are signs that whatever you have eaten, it is not good for you, and it's producing local inflammation, which can go on then to affect systemic kinds of inflammation. I've also done other videos when we talked about that leaky gut. Leaky gut, interestingly, is also associated with every single autoimmune condition that you can think of, whether it's going to be of the brain, the thyroid, whether it's going to be the joints, such as a rheumatoid arthritis, of the kidneys, of the adrenal glands. Leaky gut is associated with every single autoimmune condition in the body. Autoimmune is when your own immune system starts to attack different parts of your body as if it was a foreign invader. And think about it, arguably neurodegenerative disease is going to be very, very similar in terms of its symptomatic presentations. It's where you got the accumulation of weird debris that your immune system is not able to get rid of, but we're talking about it impacting you at the level of the brain itself. So this is why I say, and probably even more important than making sure that the spine is working right, digestive health for neurodegenerative conditions is absolutely huge. I'll throw in there another risk factor that a lot of times people don't know of, B12 deficiency. Vitamin B12, it is poorly absorbed in the best of humans. B12 is an essential building block of brain and neural tissue. and it's going to manifest oftentimes as a certain kind of anemia, not low iron, but low B12, which can cause the blood vessels, the blood cells to start to swell, what's known as a macrocytic anemia. And some of the early signs of this is when a person is either experiencing brain fog, when they're experiencing tingling down in their hands, tingling down in their fingers. It can mimic a myelopathy, a spinal cord type of issue. But the weird thing about this one then, because of the nature of its distribution, and this will usually show up on a blood test, is if a person has a B12 injection, so many of their symptoms automatically almost start to go away overnight. And this can sometimes be something that is a genetic predisposition. So to give you a bit of a personal example, I don't remember my great-grandmother, but I do remember a few stories that my own mom had said. And it was that she was starting to experience certain forms of dementia. She was having weird neurological issues. And this would have been, decades ago. And her doctor said to her, okay, let's do a few tests. And they found that her B12 was like bottom of the tank, empty. She started to have some injections just of B12, and she did remarkably well. Now, her B12 was so low that she needed an injection about once a week for the entire rest of her life. But most people don't need something like that. But one of the things that I always make sure of then is that if a person is starting to experience neurodegenerative conditions, Alzheimer's, dementia, anything like that, Parkinson's, get your level of B12 tested. Even if you have a tablet form, even if it's a methylated B12, which is the best form, I repeat, it is poorly absorbed in the best of human beings. So an injection, a muscular injection, general doc can do that, nurse practitioner can do that. You don't need a special prescription or anything like that because it's a vitamin. This can go really, really long way for helping people just make sure that they're maintaining the health of their nerves. And in fact, I would go so far as to say that as people are getting older, 50, 60 years old, very, very important. You have your B12 level checked. It can make a profound difference. Next one I've got for you. This is another really, really big one. Heavy metal exposure. This can be in the form of amalgam fillings. This can be if you've grown up in an industrial area, if you've lived in a big city for a long time, even if you commute on a bike because you're exposed to bus and car fumes and all that, or if you've grown up around agriculture for a long time where different insecticides, pesticides, fertilizer chemicals, things like that have been used and have slowly gotten into your body and accumulated over a long period of time. Why does this matter? The reason it matters is because in the brain, your blood vessels do not actually come into direct contact with any of the neural tissues. There is a very selective barrier around it known as the blood-brain barrier, kind of as I've illustrated in this little picture right here. There are linings of what are known as astrocytes. It's connective tissue that surrounds the blood vessels that only allows very select substances to pass through. Glucose, so sugar, water, oxygen, ions, the critical pieces that your brain needs in order to work. And I repeat, just like in your digestive system, these are very, very tightly controlled junctions like this. However, if a person's been exposed to heavy metal, and if it starts to accumulate into your bloodstream, it's got an affinity for 3 organs: your thyroid, your adrenal glands, and also the brain itself. And what it will do in the brain is those tight junctions and that tight barrier starts to get leaky. As a consequence, stuff starts leaking into the brain space itself, and the same as if something's getting into your bloodstream that shouldn't be passing by that route, this promotes inflammation. And when you've got inflammation on the brain is not going to be working the way that it should be. And if then you start to have a bit of a mix mash of the different signals, this can lead then to the accumulation of debris. The hallmark of an Alzheimer's is a little something that's called an amyloid protein, and in Parkinson's it's what's known as a alpha-synuclein protein. You don't usually see these substances because you'd have to do like a direct CSF puncture in order to measure them. But my point being is that, the hallmarks, the clinical symptoms of these are going to be pretty darn obvious. If something is promoting leakiness of this blood-brain barrier, it is one of the biggest risk factors for people who are going to be experiencing these kinds of neurodegenerative conditions. Now, what do you do about this? This one's very, very tricky because the body does not have built-in mechanisms to be able to rid itself of heavy metal and industrial chemicals, things like that. Why? Because these things don't exist in nature, at least in the forms that we've created in them over the span of the last 300 years or so. This, again, is where you may need to work with a holistic dentist if it so happens to be that you've got amalgam fillings, different things like that. And again, just because you may have an amalgam, it doesn't guarantee you're going to have a neurodegenerative condition. I do want to say that, but we do identify it as a risk factor. But the other person you're probably going to want to work with is a naturopathic doctor. There are different kinds of chelating agents, things that can be done to change a diet just a little bit. And what these do is these help, as your body would be trying to get rid of these abnormal substances, is essentially glue that sticks them together and slowly allows them to get out of the brain, out of the bloodstream, out of your body, so that things can again work the way that they are supposed to. Now, I might also be stepping out of my lane a little bit, but this is an important one as well. Because what's another risk factor for brain health, Alzheimer's, Parkinson's? It's statins. It's any medication whose purpose is to decrease cholesterol in your body. And I understand that the concern is if we have the accumulation of cholesterol in the arteries, that can affect the heart, that can be a risk factor for stroke, it can cause any number of other very serious kinds of conditions. But in the same breath, we also need to weigh up a few different things here. So why does cholesterol accumulate in blood vessels in the first place? It's the body's innate response to levels of inflammation. Guess what we've been talking about for the last few minutes? How does the body get inflammation? Digestive system is a big one. So if diet and lifestyle, major factors leading to the accumulation of cholesterol, your body's trying to protect itself against something. Now, why and should we be concerned about a statin medication? And again, there's a time and a place for it, so I am not saying you need to come off all of your statins, none of that. This is a conversation you need to have with your medical doctor. But this is just giving you a little bit of information. Cholesterol is going to be a type of fat. Guess what the connective tissue that lines your brain is made of? Cholesterol and fat. So if a person is on a statin medication for a long period of time, one of the risks is that it can actually cause atrophy of the brain itself. It's what's known as a vascular dementia. Mimics Parkinson's, mimics so many of these different kinds of things as well. It's one of the reasons. If you look at the labels, and if you're looking at some of the side effects of statin medications, you're going to see all of these different cognitive issues. My former father-in-law, he had a number of heart issues, required a stent put in, and he was immediately prescribed statins. He was very concerned about the heart, so he initially started taking them, but he noticed a massive change, a massive issue in terms of how well his brain was able to work, to the point where he was like, as dreadful as this is, and it's like, okay, yes, I may ultimately pass away from the heart, but I've got to be able to use my brain. This is absolutely horrendous. He stopped taking the medication. That was his choice, and I actually didn't say anything to him. He did his own independent research, and he noticed that everything in his head started to feel much, much better. Now, I will also add that not all statins are the same. Certain statins a person can take and their body just doesn't agree with them, but they can take other ones. And they say, no, I'm not noticing any cognitive impairments whatsoever. One way or another, if you notice this or a friend, family member notices this is absolutely a conversation that you want to have with your medical practitioner so that they're going to be able to find the best solution for you so that you can have best quality life, reducing the risk factors, but not then increasing the risk factors in other areas of your health. And as we cycle now to the last piece of the puzzle that I want to address, it's making sure that circulation to your brain is working the way that it is supposed to. So we're going to have arteries going up to the head, and we're also going to have veins draining blood back down. And one of the things that's very important to know about, brain anatomy is that the blood vessels, specifically the veins on the inside, they are different than the veins everywhere else in your body. The ones lower down in your body, they have little valves that work as one-way switches. In other words, blood goes down back to the heart, but it can't go back the other way. The brain is different. There are no valves in these particular veins. So if a person was ever going to be having an abnormal pressure gradient, because that's what normally drives the fluid flow, it can actually congest and it can start to spill backward into the brain. So instead of having clean water running through the pipes in your brain, you can actually have congestion and debris that starts to accumulate. And imagine then that the brain, instead of sitting in a nice clean pool of water, is sitting in a cesspool. That is absolutely going to be inflammatory, and guess what? That's going to show up in any number of different ways. That could be headache, that could be migraine, but it's also associated with the different forms of neurodegenerative conditions, MS, Alzheimer's, Parkinson's. You want to have a look at a little bit more research on that. There's a paper that was done by a fellow named Michael Flanagan who looked at this particular relationship about what's happening in the upper part of the neck. Why the upper part of the neck? Well, why is that so important? Why are we talking about it? It kind of goes all the way back to the beginning of this video about the importance of spinal health. Well, it's because when you are lying down, the normal drainage pathway from your brain is going to be from the internal jugular veins along the front of your neck right here. However, when you sit or you stand up, the pressure from the soft tissues, and this is normal anatomy, I didn't make this up, those veins actually collapse about 50%, which means that in order for your brain to be able to return blood back to your heart, it needs to go via a different pathway. And that pathway is what's known as the cerebrospinal venous system, which I have illustrated for you right here, number 30. It's going to be a series of veins that are draining off of the brainstem, off of the cerebellum, which is involved with balance coordination, and also off of the back of the brain itself, through this space at the joint in the upper neck. So the atlas and the axis, the C1 and the C2 vertebra. What's interesting about these vertebrae is that they don't have any disc that locks it in place. So if we have ever had some kind of head, neck, whiplash injury, whatever it would be, if these vertebrae are not moving properly, this represents a potential choke point, literally, where if you're normally supposed to be having 100% of blood flow coming back down, if you're only able to get, say, 90% of it flowing, that additional 10% can start to accumulate inside of the cranial vault itself. And what did we say? Those veins are going to be filled with abnormal debris, abnormal substances, and if your brain can't clear them, they can start to accumulate over a period of time. Again, this does not mean that this is the one and only factor, but I wanted to show you how it is that actually the health of your neck, and how it is, again, that by actually making sure that you have normal motion, normal function, and normal stability of those joints, it can go a long way, or at least is one of the pieces of the puzzle for helping people when they're dealing with traumatic brain injury, whether they're dealing with post-concussion syndrome, or even if they're dealing with a neurodegenerative condition, MS, Alzheimer's, Parkinson's, things like that. So there we go, a bit of a deep dive into a few of the risk factors associated with neurodegenerative conditions. But as I had said, there is a very simple screening test that you can do at home if you're concerned that a friend or family member might be showing some of the early signs of this. And it involves your sense of smell, specifically smelling out of your left nostril. Now, I will add, you're not going to be able to do this if you have chronic sinus, chronic breathing kinds of issues, but I want to show you the test one way or another, so it's worth a fair go. And again, this test in and of itself, it is not pathognomonic for Alzheimer's or Parkinson's, but if you look at it in conjunction with all of those other factors that we talked about, it starts to paint a picture. So what do you need in order to do this test? What you need is you need either fresh coffee grounds and or you need a teaspoon of peanut butter. If you have a peanut allergy, please also do not do this test. try some other kind of substance. You can also use peppermint oil, you can use licorice. Truth be it, you can use anything that you want, but these are some of the most recognizable smells that we know. So what do? You hold in this case I'll use the coffee. You don't tell the person what you're going to do, but you have them close their eyes and cover one nostril like this. And what you do is you start about a foot below their nose, and you start to slowly elevate that and tell you when they can smell it. Average person, we should be able to smell whatever that something is, probably within about 8 inches or so away from the nose. Sometimes, again, if you've got sinus congestion, it might be a little bit closer, but you're just looking for the point. Oh, yep, I smell it there. Okay, now what you do is you do the exact same thing. You cover the right nostril and you breathe through and you smell through the left side only, and do the same thing. Close your eyes and tell me when you smell it. Like, okay, yep, I smell it. So what is the abnormal finding? The abnormal finding, and it has to do with how the brain processes all of this information, is that if you say, oh, yep, I can smell it all the way down here through the right side, but then if you do it on the left, oh, yep, there it is. And it's much, much closer, somewhere around like 4 inches closer. That is an early warning sign that a person could be dealing with some kind of neurodegenerative condition, namely an Alzheimer's or a Parkinson's. So it's what's known as the peanut butter test. So our sense of smell, because of its close association with the prefrontal cortex, that part of the brain that is responsible for logic, mood, memory, and coordinates every other function going on in the brain. Super duper important. And I repeat, a very easy test that you can be doing at home, at your own, to see if there's something that requires then further investigation, especially if you're experiencing other kind of symptoms. So there we go. Deep dive on neurodegenerative conditions, again, specifically Alzheimer's and Parkinson's, showing that health of the spine is one important piece, but there's also a lot of other moving pieces that are involved there as well. Again, this is one of those longer videos. I haven't done one of these in a while, but I wanted to cover as many of those important pieces as I could, because this is, of course, such an increasingly common issue in modern society. Part of the reason, as we see the digestive, the stuff that we're exposed to, and the nature of our lifestyles, these are setting us up. Our body does not have the innate mechanisms to be able to deal with this, and then therefore we need to make sure that we are on top of this and stack the deck in our favor so that we are doing everything that we possibly can to be as healthy and well as we possibly can for as long as humanly possible. So if you've liked this video, again, please do hit that like and subscribe button and share this with your friends and your family, other people who you think would benefit from watching this. If you want to get some more information then about what it is that we do in our practice, how we can help you out, then I would recommend go to ClearChiroSpokane.com, where we've got links to other videos, we've got other blog articles, number of different conditions that are going to be neck and spine related that we can help with the overall function of your body. But even if you're not in the Inland Pacific area, what you can do is you can go to a directory. It's called UCC Near Me, where you've got a list of all kinds of different healthcare practitioners who specialize in the function, motion, stability of the joints of the upper neck. This is a different form of healthcare. It does not involve any drugs, does not involve any surgery, and there is no stretching or twisting of the neck either. It goes a long way towards helping people live the best quality life possible. So again, thanks for watching this video. I hope you enjoyed. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.